Now, a cross-party group of MPs has concluded that care homes in England were, in their words, thrown to the wolves at the start of the pandemic. The Public Accounts Committee said the government's decision to allow hospital patients in England to be discharged into care homes at the beginning of the outbreak was reckless and appalling. BBC's Panorama has been in touch with 124 care providers operating 350 homes in England. More than a third say they face severe financial difficulties or even closure. Our social affairs correspondent, Alison Holt, has the story.
This is Pelham House, a small, privately owned dementia care home in Kent, which at the start of the pandemic was looking after 20 people.
Thank you.
Like many homes, they feel, as today's report says, they've been thrown to the wolves. They kept the virus out until May, but once the first person had COVID-19, it spread quickly. Nearly half the residents have died. Roger Waluube is the home's owner.
We normally have 3 deaths on average a year, but we've had 9 in the space of 10 days. It's a shock. We're not used to death at this scale. Emotionally, it's very challenging.
It's just to get rid of this nasty virus.
Panorama has followed Pelham House as it tries to recover, but not only has it had the tragic loss of so many residents, it's also lost half its income. It may be forced to close, which would mean the remaining residents, like Cynthia, lose their home.
I do like living here, and it's very comfortable, and there's lots of nice people. It's a very nice place to be. Yes, if I had to leave, I think I'd miss a heck of a lot of it.
Panorama has contacted 124 care providers operating 350 homes. More than a third say the extra costs of coronavirus mean they now face severe financial difficulties. Here at Leahurst Dementia Care Home in Sheffield, the new screens in reception are their latest coronavirus cost. They've stayed virus-free, but COVID-19, along with low local authority fees and fewer people moving in, is still making life difficult.
We would need 100% occupancy to make a profit of £24,000. That's 168 hours a week, 52 weeks of the year, every bed to be occupied. Any lost bed is lost income. We cannot claw it back.
Coronavirus has exposed the historic problems of a care system which is fragmented, complicated and underfunded. A sign of the depth of the problems is that in Sheffield alone, care homes claim a third of beds could be lost.
Some homes have already said that they've had to make redundancies, which, given what they've been through over the last few months, that's really sad. And so we've now got the worry of, how long can our homes survive like this?
The government says nearly £4 billion has been given to local authorities to help services, including social care.
Don't forget your mask.
Pelham House is now virus-free, and Roger has received some council help, but he still needs to find more money.
I will not get to the point where I've got 2 hours to go and I've run out of cash or I can't care for people anymore. I will not leave it to the 11th hour.
Alison Holt, BBC News.